Dr. Marc Greenstein, thank you so much for coming and talking at the 2019 GOMA Fall Conference. You did a great job. Everyone seemed to enjoy your talk, talking about BPH. Tell everybody a little bit about your practice, if you don't mind.
So, Marc Greenstein, this is my 17th year of practice. I went to the Philadelphia College of Osteopathic Medicine in Philadelphia, trained in Philadelphia, worked in New Jersey for 15 years, and then came down here. This is now my second year in Georgia. I joined Advanced Urology, which is an up-and-coming, growing practice in the Atlanta area. Started in Snellville. Now we have locations in Johns Creek, Sandy Springs, Alpharetta, Decatur, soon to be Buckhead, also in Marietta. So it's a nice growing practice.
And you're in the?
I'm in the Sandy Springs location.
Sandy Springs.
Yeah.
Great. Well, you talked about medications, but you talked about some of the surgical options for BPH.
Sure.
And UroLift is, to me, I mean, now I'm familiar with it a little bit, but it's maybe new to other people. Tell the people a little bit about that.
Right.
First.
So UroLift is a game changer for treating moderate-sized prostates. So as we talked about in the lecture, prostates are about the size of a walnut. But what do you do when you have a prostate the size of a plum or a tangerine or a nectarine or something like that? Historically, guys would go and get their prostates scraped out. Then medications got invented and the surgical volumes went down. But the medications have side effects. The medications sometimes don't work very well. And so we have these procedures that are out there to open up a guy's prostate channel so they urinate better, so they can empty their bladder, so they can not worry about wearing pads and missing a good part of their movie or a part of the Falcons game or something like that. And UroLift is new. It's been out for about 5-6 years. We have 5 years of data, and all it does is it pulls open the sides of the prostate just like we would scrape out the tissue, but now all we're doing is just pulling these tissues open to open the channel so guys can urinate better. Much quicker procedure, 10 minutes as opposed to an hour, and to me it's a huge game changer for the right person.
And they don't have to have a catheter afterwards, they don't have to...
If I look at my personal data, about 50% of my guys will need a catheter for less than 24 hours,
okay.
Because anytime you do any kind of prostate procedure, you're going to stir up bleeding.
Sure.
The bleeding is usually a very mild amount, but putting the catheter in just guarantees that they're going to be safe overnight, and then the bleeding 100% times stops within 12 hours or so, 24 hours. So then the catheter comes out the next day.
Super, good. You talked a little bit about Advanced Urology, how's now working with a new type of technology for the very large prostates.
Right, so historically if a person has a very big prostate, like the size of an orange or bigger, those are prostates that are more difficult to do surgery on. The bigger the gland, the more you got to get out. And so there's a company called Prostatic which invented a technology called aquablation. Aquablation is where it's basically power washing the prostate using high water therapy to evaporate the tissue right then and there. And so you're able to vaporize this tissue in literally 15 minutes. And that's also a very important thing for these guys that have big prostates, because it's trying to reduce the side effects, trying to reduce the operating time on these very big prostates. So it's new surgery. We've done a lot of them in our practice. We think we have the highest volume in the state right now. I actually just submitted a paper to the Southeast section of the American Urologic Association. We're hoping it's going to get accepted, talking about our experience and our outcomes with this new procedure.
You said after you've done that, there may be some bleeding, so that you oftentimes will go in and do a little hemostasis issue?
Right, so sometimes it's a lot of hemostasis. We go in, the water therapy does not stop bleeding. And so they all bleed a little bit, but then I use old-fashioned technology called a resectoscope to cauterize the little areas that are bleeding, or sometimes the big areas that are bleeding. Now for that, that's just nature. We have to stop the bleeding. We have to treat these big prostates, but it is sparing them from open surgeries or laparoscopic surgeries, which is also an option for these guys that have these very big prostates.
And they're able to go home that day? And
no, we keep them overnight because we do something called continuous bladder irrigation. That's where we have these big bags of water that sit next to the bed, and they flush saline.
I remember from TERP days.
There you go. It's because it's basically a glorified TERP.
Yeah.
And so that irrigates the bladder overnight, and by the irrigation, it puts pressures on the little blood vessels as well, and it tamponades off and it stops the bleeding overnight. 95% of the time. Some people need an extra day, but our numbers show, that 90% of people are going home the next day.
Cool. Well, Marc, thank you so much for coming out and sharing your knowledge with us. We greatly appreciate it.
My pleasure.